Hello and welcome. My name is Dr. Rizwan Qureshi and I am a consultant in emergency medicine working here in Sydney, Australia. Today I'm going to share with you my top 5 tips for clinical component of medical examination. Most clinical examinations are conducted as OSCEs, which is Objective Structured Clinical Examination. Now this approach gives the examiner a better idea about the candidate's performance. It's more holistic. It not only assesses your depth of knowledge, and it also assesses your communication, your rapport, your empathy. Tip number 1, make sure that you read the task first. Now the tasks are the question related to a particular clinical scenario or clinical conundrum, and these questions might be take the history, conduct a focus examination, conduct some tests and come up with a management plan. Make sure that you read these questions and the tasks first and then read the scenario. I also call this a task-oriented approach. It helps save you time, and also please remember the candidates who actually fail a station or a scenario, they don't fail because they haven't got enough clinical knowledge, but they're actually not answering the question which are asked via these tasks. Tip number 2, ICS. Now I stands for an introduction, so please introduce yourself. My name is Dr. Rizwan Qureshi. I'm one of the exam candidates and I'm here to ask you a few questions. C stands for comfort. Ask patient if they're comfortable. If they're not, please rank the severity of their discomfort as mild, moderate and severe. Ask their allergies and offer them suitable analgesia. And S stands for stability. Most of these scenarios are conducted online or in a simulated environment, so it's very difficult to gauge the particular stability or hemodynamic stability of the patient. If you're not sure, please ask the examiner. And if the patient is not stable, please move the patient into the resuscitation area. Tip number 3, framework approach. Now this is very important. Framework is actually doing the task in the order they're asked. So the task might be to take the history. Make sure you tick off all the boxes of the history in terms of asking about the history of present illness, past medical history, drug history, allergies, social history and so forth. Also, when you're doing the examination, start off by asking for the latest set of OBS or vitals. When you're doing the lab test, please make sure that you do the lab test and organize them at bedside test. Bedside test could be anything like an ECG or a urine test. Lab test like full blood count. And also when you're mentioning the lab tests, please highlight what are you looking for. So full blood count you might be doing to check and exclude anemia, or make sure the white cell count is not too high or too low to exclude sepsis. Then comes the radiology. So organize all of the radiological tests like X-ray, ultrasound and CT scan, and what you're looking for in particular test, highlight that to the examiner or to the patient. Any special tests that you might be planning now, like an MRI scan, or might be planning in the future like gastroscopy, colonoscopy, or any biopsy tests. And now also when you're offering a patient a management plan, make sure that you cover the management as general management. Now general management could be anything ranging from analgesia for comfort reasons, IV fluids, blood transfusion for hemodynamic instability, or any other form of management like general management, like improving their oxygen saturation by offering them different modes of oxygen delivery. A specific management, say for instance your patient has come in with acute coronary syndrome, acute myocardial infarction. Activate the cath lab and inform the cardiologist first on. Then give the patient aspirin, clopidogrel, heparin, Clexane, whatever it might be. This is the specific treatment of the underlying condition. And also the disposition. If you think the patient is unstable and needs an admission to CCU or ICU, if you think the patient is well enough to be admitted to ward, then please highlight that. And if you think the patient can be discharged home, then tell the patient that you need to go and follow up with your doctor to check up on your symptoms and make sure they're getting better. Tip number 5, SQUID approach. S stands for summary. Now you spend 7 or 7.5 minutes conducting all those tasks in a very organized way. Summarize to the actor or the patient all that you've done. So you may say that, look, I've taken or asked you some questions based on your examination and those historical facts. I'd like to do these tests and offer you this management. And this is a very nice approach to consolidate the entire station in 20 to 30 seconds. Q stands for questions. So if the patient has got any question, and this might be their opportunity to ask those questions, so you're not missing out at any essential information. I stands for information. So you may have given heaps of information to the patient and you might be discharging them home, offer them some reading material or any written information. You can even make diagrams and write your own notes or discharge letter. Make sure that you tell the patient, please go and read this information in your own time at your home. And if you got any questions, you can then approach your GP with those specific questions. And D for danger signs. This is the most essential component of OSCE scenario. Always mention your patient that these are the danger signs that you need to look out for. If you get chest pain, shortness of breath, palpitation, feeling dizzy, or if you're worried about the well-being of yourself, please come back to your nearest hospital or emergency department. So that's the SQUID approach. I hope you find these 5 tips very useful. Recently, we finished the first emergency focus AMC clinical course and we did 2 of our mocks. Some of the best candidates who actually did very well in our mock examination, which were actually quite tough, were the one who stick to the framework. They did not miss any of the essential information. They did not miss any of the critical information which were an automatic fail, and they passed both the scenarios. So as a summary, I'll summarize that for you again. Make sure you do task-oriented approach. Read the task, then read the scenario. When you enter the station, ICS, introduction, comfort, checking for analgesia based on the allergies and severity of the pain, and S, asking the examiner about the stability of the patient. Tip number 3, framework approach. Framework the task of history taking, examination, breaking bad news, classify your investigations, classify your management as general, specific, and disposition decision. Tip number 5 was SQUID. You summarize, you invite the patient to ask any questions and also give them any written information or written material, and always tell them danger sign. I hope you find this information useful and you can incorporate some of this into your study plan and your approach towards your final exam. Best of luck. Thank you very much. Goodbye.